Hello, everyone. We're going to start here in just a few minutes. I just want to make sure everyone can hear us. So I do have the chat open. If you cannot hear, pop yourself in the chat and we'll try to troubleshoot. Daniel, do you want to say something? Make sure they can hear you.
Yeah. Just if everyone can hear me just fine, just let me know if you're having problems hearing. I can try and work something out with the microphone.
Perfect. Looks like nobody's. Yeah, I think they can hear us.
Cool.
All right, we will go ahead and get started because it's 4 o'clock. Hello, everyone, and welcome. My name is Jennifer Sullivan. I'm with Boone Insurance Associates, and we're really glad that you're joining us today. Whether you're turning 65 soon, already on Medicare, or just trying to understand how all of this works, we're here to try to simplify it for you with our Medicare 101 Medicare Made Simple workshop. We do these quarterly, and yeah, we're just trying to get people educated. On that note, just as a reminder, this is an educational session only. There will be no product information, pricing information, no insurance companies mentioned. We are just sticking to education and information about Medicare itself. We're going to walk you through how Medicare works, your options, and some common mistakes to avoid. And then afterwards, we'll explain how we can help people one-on-one if you want more information on the products and pricing or your personal situation. I am going to go ahead and turn the presentation over to one of my rock star agents, Daniel Higa. He has been with us for, 4 years, 5 years?
A little over 3.
Okay. And he is a Medicare expert, and he's going to go ahead and take you through it. Just a few housekeeping items. Everyone is muted just to keep background noise down. Sometimes, the dog's barking and things like that. If you have questions, feel free to drop them in the chat. I will answer them as we go. Try to keep the questions to generalized, nothing personal. We can't answer or share personal information in this setting. But again, we can talk about how we can do that one-on-one afterwards. Also, this session is being recorded and it does go onto our YouTube channel. So if you want to reference it later, it will be there and we can send out that link afterwards. Okay, before I turn it over to Daniel and jump in, we just want to ask a quick question here. Has anyone already started looking at Medicare options, or is this brand new to you? Pop it in the chat if you want to share that. It's kind of good for us to get an idea of where everybody's coming from. So you can feel free to share that as we get started. And now I'm going to turn it over to Daniel.
All right. Thank you, Jennifer. So yes, I think I'll start first by sharing my screen so we can take a look at the presentation together as we go along. Anyone let me know if you're not seeing that so that we can work on that, but it looks like everyone should be able to see it. All right, so this is our, you can see it? Great. All right, so the Insurance Made Simple is a presentation that's put together by Boone Insurance Associates to properly inform clients and potential clients of what they need to be aware of if they're new to Medicare, whether they're turning 65 soon, or whether they've been on an employer policy and are looking to retire and get off of that policy, or just for whatever reason that comes up. So we've put together a little presentation for you here. We work with health, life, and insurance products all over the state of Oregon. So if you're not locally located in Eugene or Springfield, that's fine. We can still work with you by phone or email. We work directly with companies to resolve any of your claim, benefit, and premium questions. So we're not just here to sign you up for a policy. We're actually here to help you if you have questions with your care, questions about unexpected invoices, things like that. So we're also independent brokers. So we're not stuck to a specific company. So if you're going to ask us which plan was going to work best for you, you're actually going to get an answer based off of your needs rather than specifically pushing a specific product. Now, the information that we're providing you today is educational, and there's no obligation for you to purchase any services from us. Now, if you're new to Medicare, if you've not started anything whatsoever, your first step is basically going to be to register with the Social Security Administration. You can do that at socialsecurity.gov or ssa.gov, and you can sign up for your Part A and your Part B. We'll get into all those letters in a bit because there's a lot of them. But essentially, you need to have Medicare with the government before you can explore or sign up for options that we'll discuss in a little bit. If you're over 65 and you are just kind of looking for options because you're getting close to retirement, or maybe you're under 65 but you qualify for other reasons such as disability or end-stage renal disease, those can be other things that we'll discuss in a little bit in the future as well. But there are basically the initial enrollment period, which is when you're about to turn 65, you have 3 months prior to your birthday month itself, and then 3 months after your birthday month to enroll in Part B and into a plan. All right, so if anything outside of that, or outside of the open enrollment period, that's what's called a special election period. And you, for that, would want to do something along the lines of if you lost your current coverage through your job, or if you've moved from one service area to another, so things like that. So let's see here. On the next one. As I was explaining earlier, it's mainly for people 65 and older, but people under 65 who have been declared disabled for 24 months can qualify. And then people with end-stage renal disease, also known as kidney failure, can also apply for Medicare. So you'll hear this a lot. This is basic terminology, is you have the deductible, which is how much you might have to spend for covered health services before your insurance company pays for anything. This does not include preventative services like annual checkups and preventative screenings and things like that. Now, if copays and coinsurances are what payments you are expected to make for certain types of visits, and sometimes copays are typically, just flat dollar amounts, regardless of the cost of the service. Coinsurances are a percentage that you pay of the service. Out-of-pocket maximum is essentially once you've paid up to that amount for the year, you're done with any covered service. You've paid to the maximum, and the insurance carrier will pay for the rest of it afterwards. Now here we come to the A, B, C, and D of Medicare, which can get very confusing, but I will try my best to explain them. The first is Medicare Part A, which is hospital care. Medicare Part B is the medical care. And we'll get into a little bit more, but the main difference between the two is hospital is things that are done when you have to stay overnight in the hospital for the most part, and then medical care are more for things like checkups, immunizations, things like that. Now, Part C is simply a private company, let's say United Healthcare, Pacific Source, whoever, just to name a few. They are managing your Part A and B, and usually D, and they kind of put it all under one umbrella. And so that's what's called Part C. And then D is prescription drug coverage. So whether you have that as a part of a Medicare Advantage plan or you have it as a standalone prescription plan to go along with a Medigap plan or original Medicare, that's what that is. So we will be referring to these in the future. Feel free to ask any questions if this gets confusing. It certainly can be when you consider all that together. All right, now Medicare Part A, how much does it cost? Basically, most people will have contributed to the Medicare system in their payroll deductions through their Social Security tax deductions. So as long as someone has been contributing quarterly, not quarterly, I'm sorry. If you've been contributing for 40 calendar quarters, so that's roughly 10 years, towards your Social Security, you won't have any Part A premium. And that is most people, but sometimes some people get involved later in life, or maybe they only worked for a few years when they were younger and they stopped to be a homemaker or something like that, and they have less than the 40 calendar quarters, they may pay a small amount for their Part A premium. Part A, like I said, it's basically stuff that happens when you stay in the hospital. So hospital stays, home health services, hospice care, minimal care in a skilled nursing facility. And there's, all the details of it. So after a 3-day hospital stay, it covers the first 20 days in full. After the 20 days are up, it covers 21 through 100 at the daily rate. And then after 100, it just doesn't cover it all. So this is not long-term care plans. This is more for short-term, 100 days being a short-term. It does not include intermediate or custodial coverage. So, typically that's sort of care that you receive, outside of the hospital, like maybe coming to your home or something. So here's a breakdown of that. I mean, it's a lot of numbers. Certainly, we are happy to discuss those more in detail in appointments that we have. If you have questions about those, or if you see any of this here that you want clarification on, feel free to pop it into the chat. But basically, it does mention the Part A covers the hospital stays as well as skilled nursing facilities. And these are kind of the breakdowns of the general costs, at least for this current year. All right, so Medicare A benefits periods. Basically, they begin on the day you go into the hospital or skilled nursing facility, and they end when you have not received hospital care for 60 days in a row. So basically, they go into periods of time. And if you let's say you went to the hospital in January, and then you left the hospital, and then 3 months down the road, which is more than 60 days, you end up in the hospital again. That starts a new period. Part B is the part that most people need to decide whether or not they're going to opt in. Part A is something that just kind of happens when you turn 65 for the most part. Part B is sort of a choice because there's a premium involved with that. And so if you have a premium, you're paying for something that gets taken out of your Social Security check, or if you're not drawing from Social Security, they will just bill you for the invoice. Most people will fall in the first category, in which their annual income, either as an individual or a couple, does not exceed these amounts here, the 109,000 or the 218,000. And they will pay the standard $202.90 a month. So that's kind of the standard. Of course, if you make more than that, you can kind of see in your bracket how much you might pay per month for your Part B. Part B, like I mentioned earlier, is for stuff that's typically done at checkups, so physician services, labs, x-rays, scans, chemotherapy, ambulance, emergency care, room care, outpatient surgeries, preventative care, and some Part B medications. That would be essentially prescriptions, but that are administered in a hospital, usually like an infusion of some sort. Now, deductibles and coinsurance. Deductible for 2026 is $283 a year. Other services, after your deductible is met, you typically pay 20% of the Medicare approved amount for most doctor services, outpatient therapy, durable medical equipment. The $283 per year deductible is basically what Medicare Part B costs us in general. That deductible might be covered by the carrier if you decide to go Medicare Advantage route and pay that way. Let's see here. So out-of-pocket maximum spending safety nets. So original Medicare does not cover certain things. It doesn't have an out-of-pocket maximum, which means that if you end up paying the deductible and then you have your 20%, Medicare pays 80%, you pay 20%. There's no limit to what that 20% could be on original Medicare. So depending on the situation you're in, that could be a lot of money. We'll talk about it a bit more later, but Medicare Advantage plans, for example, do have maximum out-of-pocket safety nets. So the most you might pay is maybe $6,000, $7,000 in a year. Certain deductibles and co-insurances are typically paid when you go to your doctor. Beyond the one-time initial physical and annual wellness visit, routine physical is not included. Dental, except if medically necessary, which is a very, very small, you have to qualify for those, and it's certainly not like your annual dental checkups you might be used to. Same thing with vision. Access to complementary alternative care benefits. So Medicare Advantage policies, for example, might offer the ability to go to alternative care, such as things like chiropractic or acupuncture, things like that. Original Medicare has virtually none of that, with the very, very, very few exceptions. They also don't cover extra perks that a lot of carriers cover, such as gym memberships, or other perks that they might offer. All right, so now coming to medical and prescription gaps. Three main options available are traditional Medicare supplement plans, Medigap, and you would pair that with a standalone Plan D prescription drug plan. Medicare Part C, which I mentioned earlier, is A, B, and usually D rolled up into one window. And then the employee-sponsored retiree plans, for example, PERS. A lot of people in government typically get those retirement-type plans. All right, so this is a diagram of Parts A and B and how they are managed depending on how you want to do it. Medicare Supplement, which is also called Medigap, and then Part D prescription plans. These are two separate plans to manage medical and prescription versus Medicare Advantage, which is just one plan. All right, and before I get too far ahead of myself, since we're kind of going into more descriptive things, rather than the structure of Medicare itself, I'm just wanting to know if anyone has any questions right now that they might want to ask before we proceed on to the different types of plans.
Going good so far, Daniel. We did have a question about the Part B premium that might be important to touch on real quick. And this was a question about what happens if your income is high, and how does that affect, premiums going forward? So I was just explaining in the chat that they base it off of your tax return from 2 tax filings back. So if I were to sign up today in July, I've already done my 2025 taxes, right? Because we're after the deadline. So they wouldn't look at 2025, they would look at 2024. If I had not filed my tax return for 2025 yet, and I had filed an extension and I'm waiting till October, then my last one would be 2024. They'd look at the one before that, which would be 2023. So they're going to look at 2 tax filings back. That's how they're going to base your Part B premium. After you're rolling on Medicare and you have at least one tax return that shows a lower income that would change your Part B premium, you can actually go to Social Security and ask to have it reevaluated. They're usually not going to do it on their own, right? But if you ask for reevaluation, they will look at the most recent tax return where your income dropped, and they'll adjust the Part B premium accordingly. So hopefully that makes sense. Did that make sense, Daniel?
Perfect. Yep, absolutely.
Okay. So I think that's the only question so far.
All right, fantastic. All right, then we'll jump into Medigap then. So private companies sell Medicare supplement plans, also known as Medigap. After initial enrollment, they may require health statement underwriting. Exception is the birthday rule, and we'll get into that. It's quite a process. Nationally standardized plan designs, plans A through N. Prescription drugs are not included in plans sold after 1/1/2006. So you'll have to get a Medigap plan and then add a prescription plan because they don't include them in there. Medicare pays for Medicare eligible benefits, then Medigap pays the plans portion. So Medigap also pays some benefits not covered by Medicare, and that varies. Some companies like to add additional stuff, but mostly it's just what original Medicare covers. So I talked earlier about how after you meet your deductible, Medicare will cover 80%, then you cover 20%. So that 20% is the gap. So a Medigap policy would essentially cover that once you meet certain criteria. So depending on the plan, for example, the most common plan is called Plan G, and that plan would have you pay the deductible, the $283 deductible, and then they will cover that 20% in full for anything covered. So you wouldn't see any bills essentially after you pay your deductible, as long as the coverage is covered. All right, Medicare supplement features. You may see any Medicare provider in the US, which is a very nice perk given all the craziness that goes around these days with plan limitations and where you can see doctors and things like that. So if you have a Medigap policy, you can see any doctor in the US who takes Medicare. You're not required to have a primary care physician, and you can see any specialist. So all of your care is subject to what Medicare allows and must be medically necessary. The doctor codes it, and the claim is submitted to Medicare. If Medicare pays on the claim, then Medigap, your secondary insurance, will also pay on it. If the claim is denied, the secondary insurance cannot pay it. So it's not a matter of, so-and-so carrier saying, oh, I don't want to pay, this claim. It's Medicare who has decided it's not medically necessary, or perhaps it was billed incorrectly, and then goes from there. So who's eligible to enroll? They must be enrolled in Medicare's Part A and B. This is Medicare Advantage, though, I'm sorry. Medicare Advantage Part C. This is the sort of the alternative route. If you didn't want to go the Medigap route with the prescription plan added onto it, or in addition to it, you would go the Medicare Advantage route, in which case everything's just kind of under one umbrella. You must be enrolled in Medicare Part A and B, permanent resident in the plan service area. So that's kind of a hint as to some of the limitations, whereas the other type of plan, you could just go to any doctor who takes Medicare in the country. This one's going to have service areas, and it's going to have networks. Apparently cannot have end-stage renal disease, with certain exceptions. Medicare Advantage options. So choose from options with or without integrated Part D prescription drug coverage. So no drugs included, Medicare Advantage only. These are more rare because they typically apply to people who have a prescription drug plan elsewhere, usually through the VA or some sort of veteran-related option. Then the other one is that prescription drugs are included, which is called Medicare Advantage with drugs, or MAPD. All right, so networks. There are different types of networks, and the landscape is constantly changing. But essentially, preferred provider organizations, or PPOs, are the most flexible. Now, they have a network of providers, but also let you use providers who are out of network. You may have to pay more for that, of course. Referrals are not usually required, and it's more flexible than HMO, but generally speaking, tends to be a bit more expensive. There's HMOs, which are called health management organizations. They cover services by providers within their network. So they are very limited. Some networks are bigger than others, in which it's not as big of a deal. But typically speaking, you're going to have an HMO. You're going to have a limited number of doctors to work with, and the doctors tend to be more restrictive. So you have to get referrals, for example, to see certain specialists that are in network. Then there's the private fee-for-service, no plan network. Plan works like original Medicare, except with insurance company, except the insurance company pays. Provider must be willing to accept the plan's terms. My understanding is, I don't think, Jennifer, if you can correct me on this, those types of plans aren't available in Oregon, or are they?
That's correct. There are no currently none of those plans available in Oregon.
Okay, perfect. All right, Medicare Part C features. In general, most plans offer additional benefits and lower out-of-pocket costs compared to original Medicare. I mean, anything lower than having no out-of-pocket costs is lower. They usually are at a minimum price. These plans provide the same coverage as Medicare. Typically, plans include co-payments and co-insurances, which are paid when accessing healthcare services. Additionally, many plans offer extra benefits such as routine vision exams, preventative dental care, alternative therapies, gym memberships, and more. So that's one of their major selling points is you're going to get more with an Advantage plan for these certain types of things. Dental is usually pretty huge. Most people need dental. Vision is also really good, and alternatives such as some carriers will cover like naturopathic doctors, for example, whereas Medicare would not typically do that. Medicare provides a fixed monthly payment to the plan to manage your care. So when you see a plan and it says that the monthly premium for it is, let's say, $0 a month, wonder how they make their money. That's how they do it. They get a fixed monthly payment to the plan to manage it. Medicare Advantage plans are required to offer all the benefits included on original Medicare and may also include Part D prescription drug coverage. You may be required to use a network of providers that are affiliated with the plan. All right, going into Part D, which is prescription coverage. The basic plan design has three elements: deductible, initial coverage, and catastrophic coverage. Providing your prescription drug list to your agent, i.e. one of us, can help determine which plan might be the best for you because different carriers have different contracts. So they might have you might be taking one drug that has a better price with a certain carrier. So when you provide that to us, we can look that up for you and help you make a good decision. And the plans can change every year. You're typically going to receive annual notices of change from the carrier that you're currently on that says, hey, we've updated our price structure, our benefit structure, things like that. So for prescription drug coverage, the deductible for prescription is $615, and that's for the year. Initial coverage, you pay 25% of the cost for covered prescription drugs until your total out-of-pocket spending reaches $2,100. That's the current limit. Then once your out-of-pocket spending reaches $2,100, you pay $0 for covered prescription drugs for the remainder of the year. So if you have a particularly expensive drug that pretty much takes you up to that catastrophic coverage within like the first month or two, then the rest of the year, that same drug will be covered at no extra cost. All right, so Part D options. Private companies must be approved by the Center for Medicare and Medicaid Services, CMS, to offer Part D prescription drug coverage. There are two ways to obtain prescription drug coverage.